Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about patient information. Patient information is one of those things that every clinic, every practice, every healthcare entity has on file. And it's something that we rely on heavily for multiple different reasons. One, you need to make sure that you have a good mailing address to send them information that they need, right? Bills, lab letters, if you're still doing paper, notifications. Their email addresses now in the electronic age with patient engagement platforms and stuff. Emails are widely used for patient portal access and a bunch of other things. Phone numbers for reminders, making sure that patients have follow-up appointments if you have staff that need to call them, or you have like a machine or some type of patient engagement platform that will call patients. Same with mobile numbers for text messaging if you have a platform that utilizes text messages for any reason. And a lot of people, especially for established patients, get a little complacent, I guess would be a good word, with the information that's already entered in system for patients that are established. And this is especially true for front office staff because they're usually very busy, especially in small practices, private practices. Front office people have a lot to do. They're answering phones, they're checking people in and out, they're scheduling appointments, they are collecting money, they're working on maybe some other kind of little project. Maybe they're responsible for getting referrals or authorizations for certain things. And I'm going to be honest with you, it's human nature. We try to cut corners where we feel it's appropriate. And a lot of times, front office staff cut corners by not verifying patient information. And that usually happens when it's in a specialty where they see patients regularly. Physical therapy, primary care, anything where patients are seen more frequently than maybe once a year, twice a year. And also, as humans, we get really busy, especially this day and age with everything going on, and things will change, but we forget to update those changes in the places where we maybe don't go all the time. In our minds, going to the doctor every month or every few months, you might think, I need to update it with them, and you forget. Or you'll go, oh, I'll let them know the next time I'm in, and you forget. It's not like one of those things where you're like, you call the doctor's office and you're like, hey, I moved. Can you update my address? No, usually people wait until they're seen the next time and they try to remember. But honestly, it's not the patient's responsibility 100% to update the address with the practice. The practice should be asking patients to confirm their addresses, to confirm their email addresses, to confirm their phone numbers, to confirm their insurances. And this is where the revenue cycle starts. It starts at the front desk. This is where communication with patients starts. It starts at the front desk. And if your front desk is slacking and they're just making assumptions, and we know what assuming does, right? It can be very messy for multiple different reasons. Trying to get a hold of patients when you need to get a hold of them and not having accurate information could be very harmful to the patient's health. Maybe there's something major the doctor needs to get a hold of this patient for, and you don't have that information. Maybe you don't even have an emergency contact on file, so you can't even call the emergency contact to ask them to call the patient to have them call your office or obtain their updated number. Skipping on this information, updating this information, collecting this information could be detrimental in some really bad ways. Now, hopefully that doesn't happen very often, it being so dire that you need this information, but at the same time, it could affect your revenue and collecting from patients because you're not able to send statements without a good address and it just keeps getting returned. Maybe you have typed something wrong in an email address. Maybe it's not that it needs to be updated because it changed, but it needs to be updated because it was entered incorrectly by the user, the staff member that entered it. There's so many different things. And it's one of those places that I feel managers and administrators don't stress enough how important it is to make sure that the staff are confirming the information on file for patients. Again, do you still live at 54321 address? instead of saying, do you live here? Yes. You can put more details so it catches their ear. They'd be like, oh no, that's not my address, 54321. No, it's 12345. Oh, it looks like we have the incorrect address. Let's get that updated. I prefer, honestly, and I train my staff not to ask yes or no questions when it comes to validating their information. I ask them to give me their address numbers or the street they live on, because then I have to actively look and compare to what they're saying and what's in the system. Because if it doesn't match, you know you need to update it. Do the last four digits of your phone number end in 3214? No, that's an old number. We need to get that updated. Or what are the last four digits of the number we should have on file for you? What is the insurance we should be billing for you? That gets the patient to actively think and engage in the conversation, because if you ask yes or no questions, so many people are distracted with other things, or they're forgetting that something did change recently and they just answer yes because what they heard is their old thing and they're used to answering yes. So the yes and no's can be really bad too. So again, I always adopted the practice to ask them a piece of the information to recite back. And if it doesn't match, then get the whole thing and update it. But updating information is super important. We're coming into deductible season very soon. If you don't have a strict policy on this, or your policy is to make sure that patients' information, their paperwork, everything gets updated every year to make sure, like their HIPAA, their finances, if you have any new forms, they get signed. If that's something, then start having those trainings, those conversations with your staff now. But also make sure you're listening to your staff when they're engaging with patients, to hear how they're interacting, to make sure that they're doing what they're expected to be doing. Because if you're not paying attention and you're assuming that they're doing it correctly, that's bad on you as a manager, owner, provider, administrator, because somebody should be holding them accountable. Somebody should be coming up behind them, checks and balances, making sure that even though they know that's the expectation, they're actually doing it. And if you notice they're not, then walking up to them in private, taking them aside and saying, look, I've watched you check in or talk to 3 or 4 different patients. You've scheduled them on the phone, and I never heard you ask about confirming their information we have on file. I need you to do this because of A, B, C, and D. This is something that's very serious. I'm going to be watching. And if they know that you're paying attention, hopefully they start doing it, and they just get in the habit of doing it every time. And that's what I tell my staff too. Get in the habit of doing the same thing the same way every time, so you don't miss a step and you don't kind of convert or stray from, I should say, the path, and that you do this, and this every time, and it's just very methodical and it's all getting done the way it should be. But again, it's the end of the year. Things are going to be starting fresh soon with the new year, with new insurances that they're going to have to be asking about anyway for deductible season, because 85% of people have new insurances that start over at the first of the year. So this is a perfect time to start talking to them about the expectations of not only checking what's insurance is supposed to be billed and the ID numbers, but also the demographic information, because then it just makes things so much easier in the long run when you're trying to contact patients, when you need to collect money from them, etc. If you have any questions or comments about this, please leave that in the comments below. If you can't tell, I'm very passionate about this subject, because I have experienced too much with too many people where this isn't done consistently, or nobody's making sure the staff is doing what they're supposed to, and it just snowballs and creates a huge mess downstream. So be proactive instead of reactive, and really make sure this is an expectation with your staff, and that somebody is following up and making sure they're doing what they're supposed to. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this video with anybody whom you feel would benefit. Take care of yourselves. We'll see you next time. Bye-bye.